Hello again. Welcome back to the MSAG's COVID-19 series. In our previous videos, we've covered the timeline of the pandemic and the response to COVID-19 in the UK, and looked at the positive opinions of how the UK handled the pandemic well. In this video, we're going to show you some of the critical opinions about the UK's COVID-19 response. This will help you to form your own opinion and give your interviewer a balanced response when they ask about this in your medical school interview. Let's dive in. Pause the video and take a minute to answer this question. When it comes to the UK government's handling of the COVID-19 pandemic, what could they have improved? Critical opinion number 1. Slow initial action. The first criticism of the UK's COVID-19 response is that some people say they acted too slowly to initiate measures such as the national lockdown. This graph from the UK government shows us the number of positive daily COVID-19 cases from the 1st of March to the 10th of June 2020. You can see that COVID-19 cases rose rapidly in March. The UK government implemented its first national lockdown on March 26th. As you can see, the number of daily cases of COVID-19 plateaued and then decreased. This is evidence that the UK government's lockdown was a success. However, some have criticized the UK government for implementing this lockdown too late. A lockdown was introduced in the UK on the 23rd of March. The UK implemented a lockdown many days after Spain, Italy, and France. Why did the UK government wait nearly 2 weeks before implementing a lockdown? Could an earlier lockdown have helped to prevent the early spread of COVID-19 and save lives? Speaking at a live televised briefing on March 9th, England's Chief Medical Officer, Chris Whitty, said, "It is not just a matter of what you do, but when you do it. Anything we do, we have got to be able to sustain. Once we've started these things, we have to continue them through the peak, and there's a risk that, if we go too early, people will understandably get fatigued, and it will be difficult to sustain this over time." The British Medical Journal was particularly critical of the UK government, saying that it did too little, too late. They argued that the World Health Organization declared an emergency on the 30th of January. So why did the UK wait until the 23rd of March to impose a lockdown? Critical opinion number 2. Underdelivery of contact tracing. The second criticism of the UK's COVID-19 response is that they underdelivered on their promises for COVID-19 testing as well as in contact tracing. The UK government decided to abandon its contact tracing strategy on the 12th of March 2020. The UK government moved testing capacity only to patients admitted to hospital. Professor John Newton, the UK's testing chief, said that the UK predicted 1 million COVID-19 cases within a short period of time, and so contact tracing would have been impossible. Due to the wide spread of infection, testing NHS patients and staff was made a priority and took up all of the testing capacity. This drew criticism from some public health experts. For example, Professor Chang, the professor of public health at the University of Birmingham, said that the UK abandoned contact tracing way too soon. Critical opinion number 3. Resource allocation. Specifically, Nightingale hospitals and the PPE crisis. Another criticism of the UK's COVID-19 response is that money and resources were not used as well as they could have been. An example of this is the Nightingale hospitals and the PPE crisis. The construction of the Nightingale hospitals was considered a success by many, and it was certainly a logistical achievement. They were built because there was a serious concern that the NHS would become overwhelmed, and that hospitals would reach capacity. However, the Nightingale hospitals have drawn criticism from some. As of May 2020, only 51 patients were treated at the 4,000-bed NHS Nightingale Hospital in London. As a consequence, this new facility in London was placed on standby from the 4th of May and did not take any new patients. The hospital in Manchester treated a handful of patients. The hospitals in Birmingham and Harrogate had not treated a single patient. Some people are now asking the question, were resources and efforts disproportionately focused on building intensive care capacity? A research report from the Institute for Social and Economic Research concluded that almost 2/3 of patients in the UK with common life-threatening conditions have been denied care by the NHS because hospitals were focused on fighting COVID-19. The research also found that 63% of people with serious long-term conditions had their planned treatment cancelled. This could suggest that we may be storing up greater health problems for the future, and perhaps resources were disproportionately allocated towards creating as many extra critical care beds as possible. Personal protective equipment, commonly known as PPE, is designed to protect you from harmful substances and can prevent the transmission of infection. PPE includes things such as gowns, visors, aprons, masks, and gloves. Healthcare professionals rely on PPE to protect themselves and their patients from the spread of infectious diseases. The COVID-19 pandemic caused an extraordinary impact on the global demand for and supply of PPE in 2020. There was a huge demand from the NHS and care workers in the UK, as well as demand from other countries. The UK government has been criticised for its preparedness for a pandemic. In particular, there has been criticism from a Panorama investigation that accused the UK government of failing to buy and stockpile crucial protective equipment to cope with the pandemic. There were no gowns, visors, swabs, or body bags in the government's pandemic stockpile once COVID-19 reached the UK. At the beginning of the COVID-19 pandemic, the UK government needed to acquire more PPE and quickly. The UK government had some success for rapidly establishing a new international supply chain and distribution network for PPE. However, the UK government's planning did not go far enough, with neither stockpiles nor distribution arrangements able to cope with the extraordinary demand created by the COVID-19 pandemic. Although the UK government has been criticized for its ability to secure PPE early on in the COVID-19 pandemic, it's not all bad news. As of November 2020, the UK government announced that the health and social care workers in the UK have access to an uninterrupted supply of PPE. They also announced that they have 4 months' worth of stockpiles of face masks, visors, and gowns. Critical opinion number 4: mixed messages in communication and havoc over Christmas. The final criticism of the UK's COVID-19 response that we'll discuss in this lesson is the criticism on the government's mixed messages in communication. It is a challenge for any government to communicate effectively with the public. This is particularly true in a pandemic situation, as the information is often constantly changing and can be quite technical in nature. The UK government did get some things right in its communications. For example, the government has provided televised press conferences throughout the pandemic to keep the public updated. However, the government has been accused of sending mixed messages to the public. This was particularly seen over Christmas period in the UK. Some people have said that the government gave out confusing Christmas coronavirus rules. In November of 2020, the UK government announced that up to 3 households could form a Christmas bubble for up to 5 days from the 23rd of December. Fiona Godley, the editor of the British Medical Journal, warned that permitting this festive loosening of restrictions would be to blunder into another major error that would cost many lives. Only a few days before Christmas, on the 19th of December 2020, the UK government changed its mind. The old Christmas bubble was scrapped. Anyone under Tier 4 restrictions could not meet another person on Christmas Day. For everyone else, the new Christmas bubble policy was changed to allow 3 households to mix only on Christmas Day. So what does the public think of the government's response? Research from the Health Foundation showed that support for the government's handling of the pandemic has decreased over time. In May 2020, 60% of the public thought that the government was handling it well. By July of 2020, less than half of the public, 43%, thought that the UK government handled the pandemic well. In summary, we've discussed a few of the ways that the UK government has handled the COVID-19 pandemic and the impact this has had. As we said at the beginning of this series, it's not possible to cover all of the ways that the UK government has handled the COVID-19 pandemic. However, it is crucial that you are able to give a balanced answer when discussing the UK government's handling of the COVID-19 pandemic in your interview. It's important to have a balance in your interview answers and to back up what you say with concrete facts. So far in this series, we've looked at the breakdown of COVID-19 and how the UK has handled the pandemic. In our next video, we'll start looking at the impact that the COVID-19 pandemic has had on various groups, such as patients, people with chronic conditions, and ethnic minority groups. Best of luck on your interviews, and we'll see you in the next video.